Good morning, everyone, and welcome to the webinar. Today, I'm joined by my friend and colleague, Renae Vollmer of UnitedHealthOne. She'll be going over short-term and ancillary. This is part one of a two-part series. Today's series is just half an hour. We'll do it again next Wednesday, and she'll talk more on their indemnity products next Wednesday and some other tools as well. So today is part one of two parts. And little housekeeping. If you got a question, put it in the question box and we'll address those. But I want to also point out, I'm going to unmute everybody. Okay, I'm going to unmute everybody in the conversation. Okay, so 20, 30 folks on the line. Be sure to mute your own desktop, but we want everybody to kind of jump in if you've got something you want to talk about. And Eric's on the line with me, and hopefully everybody's unmuted. Do you see that, Eric? I clicked unmute.
Let me check on there. Yep, everyone should be unmuted.
Okay, so everybody's unmuted. And so jump in if you got something to comment about. We want a free-flowing, just freewheeling discussion about UnitedHealthOne. And great, I hear some people out there too. So here's my information. Here's Eric's information. Okay, if you have anything concerning the individual market, any questions you have about everything and anything, we're the largest wholesaler in Ohio for individual, and we can help you reach your goals for the individual market, whether it be ACA, short-term, ancillary, you name it. And then I also want to point out our enrollment tool that we like. We're not making people do it, but this is the enrollment tool that we prefer. It's called Health Sherpa. It's free. You get absolutely no cost associated with this, nor does this impact your commission. Your commission still comes directly from the carrier or from Cornerstone. And so this is just a neat tool. Health Sherpa has been around a few years, and we can walk you through this. Okay. So with that, one more slide, sorry. Learn about our $7,000 Cornerstone Incentive Cash Program. Go on our website, check it out. Qualifying period is between now and the end of the year. So starting January 1st through the end of December 2022, you can earn up to $7,000. Fantastic. We've had great success with this. I want everybody on the call, if they can, to jump on there and sign up for this. Let's toss it to Renae. Renae is in beautiful Wisconsin. Is that correct?
Yes, I am. Okay. Yeah.
You're in the Milwaukee area, is that right?
No, I'm 30 miles north of Green Bay.
30 miles north of Green Bay?
Way up in Wisconsin, yep.
Oh my, Packer country.
I could be to Canada in a couple hours, so.
Okay.
Yeah.
And let's toss it to you.
Yep, like I explained to Geoff before I did this presentation today, we've started to do our presentations a little bit differently in the fact that we kind of all burned out on webinars over the pandemic. I'm sure you guys did as much as I did. And so rather than me just talk for 30 minutes and at the end of it, hope that, it was impactful or you took something away from it, we started to run them. I started to run my webinars to be more interactive. So instead of waiting till the end for questions, please do unmute and ask me the question during the presentation. If we land on the slide and you have additional questions on it, ask me then. Interrupt me, go ahead and ask me. If you're not comfortable asking the question that way out loud, then also go ahead and use the chat feature if you'd rather do the chat feature. I've been with the company 19 years, so I've been here a long time, pre-ACA all the way up till today. And we're going to talk a little bit about our short term. I'm going to probably go a little bit fast because we only have 30 minutes, but like I said, go ahead and jump in anytime with questions. Top 5 states for short term, historically and present day, have been these 5: Texas, Florida, Ohio, Pennsylvania, North Carolina. So you guys are number 3 in our short term market. We show you this slide to let you know kind of where your state may land in the top 5, but also to give you an idea if you're ever interested in non-resident licenses in other states. These are some of the states that you may look to add because they're top selling states. Benefit level and state variations associated with the plans are extremely important. So view the product brochure when discussing plans to make sure you're providing an accurate plan description to your clients or to your customers. It's also important to know that each plan is going to have its own deductible, coinsurance, and out-of-pocket limits. And as we all know, increasing the deductible and the coinsurance is going to give the customer a lower monthly premium. Here's a quick look at how the plans generally compare as far as price is concerned. Again, this is a general comparison. Depending on the duration of the coverage, there can be some variation to the pricing relationships. There's also a lot of important differences in the plans that we will touch on. The hospital and surgical and value plans have a $1 million lifetime max per covered person. The other plans have a lifetime max of $2 million per covered person. And these plans would include the Plus Elite, the Premier Elite, and the copay plan. So now we're going to just take a closer look at the plans, and we'll start with the hospital and surgical plans. Hospital and surgical plan includes a lifetime maximum, like I mentioned, of $1 million per covered person. This plan is designed to offer the lowest premium, and there are some important plan differences. Because of these differences, the hospital and surgical has its own brochure, so make sure you pay attention to that when you're pulling up a brochure in the broker portal. The customer can choose one of 3 per term deductibles, and the choices there would be $5,000, $7,500, or $15,000. The deductible is per covered person with a maximum of 2 per family. Hospital surgical plans also have a 50-50 coinsurance. So this gives the customer a $10,000 out-of-pocket maximum after their chosen deductible for in-network covered expenses. So what that means is it's going to be $50,000 of coinsurance, add that to their chosen deductible, it gives them their maximum out-of-pocket. Hospital and surgical short-term plans cover exactly what the name implies, hospital and surgery-related benefits. It's designed to help people with catastrophic type coverage or unexpected illnesses and injuries. However, with the hospital and surgical plan, each covered person has 2 $75 copays for urgent care visits. Subsequent visits are going to be covered subject to the plan's deductible and coinsurance. With short-term medical, hospital and surgical, office visits aren't covered, and that's one of the main reasons for the lower premium. Outpatient prescription drugs are also not covered with short-term hospital and surgical. Again, another reason that the premium is lower. And customers will automatically receive a prescription discount card. Our next plan is the value plan. It does include the lifetime limit of $1 million per covered person. Customer can choose one of 4 per term deductible choices there, $2,500 through $15,000. And it has a 70-30 coinsurance, and the customer's out-of-pocket maximum is $10,000, again, after their chosen deductible. So again, don't worry so much about the 70-30 coinsurance piece of it. Our brochures sometimes are a little confusing when it comes to that. Just know that the coinsurance of $10,000 is going to be added to their deductible, and that would give them their out-of-pocket maximum. Short-term medical value, office visits don't have a copay, so they're going to be subject to deductible coinsurance. Also features a $50 copay for urgent care visits. Urgent care visits are also not subject to the plan's deductible or coinsurance, so this is just a flat $50 copay. And even though the value plan has a lower price, it does still feature coverage for outpatient prescription drugs. So covered 1-tier prescriptions have a $25 copay. Tiers 2, 3, 4 are covered subject to the deductible and coinsurance after the insured meets their deductible. And outpatient prescription drugs are subject to a $2,500 maximum for covered persons per person per term. The next plan is the Plus plan. That does include a $2 million lifetime max per covered person. And on this one, the customer can choose from 4 per term deductible choices, anywhere from $2,500 to $15,000. And it has an 80-20 coinsurance for another $2,000 out of pocket. So again, $2,000 plus the deductible, is going to be their coinsurance, or is going to be their maximum out-of-pocket. With short-term medical plus plans, office visits, again, don't have a copay. They're subject to the plan's deductible and coinsurance. They do feature the $50 copay for urgent care visits. Outpatient prescription drugs, again, are going to be covered with the 4 tiers that we saw previously. Tier 1 being a $25 copay. Tier 2 through 4 deductible coinsurance. And this one has a $5,000 maximum in outpatient prescription drugs per covered person per term. The next plan is the Plus Elite plan. This is the one, if you get anything out of this webinar, this is the one slide you want to pay attention to. This is the best-selling plan in the short-term product portfolio. 70% of our sales, upwards of 70% of our sales are the Plus Elite plan. And the reason for that, you're going to choose your deductible, $2,500 to $15,000. And after that, 100% coinsurance. So this one's easy. Deductible times 2. You now have your family's total out-of-pocket exposure. They hit their deductible. They're going to be at 100% coinsurance. It's the reason we believe it's the best-selling plan. It's very cut, dry, easy to understand from the consumer standpoint. They also don't have an office visit copay, that they would be covered at 100% after the deductible has been met. They also feature the $50 copay unlimited. And outpatient prescription drugs are covered with that 4-tier schedule that we saw in the previous 2 plans. Premier Elite, again, if you take anything away from this webinar, this would be number 2. The plan we just looked at was the Plus Elite. I would quote that if you're quoting an individual. If I'm quoting a family, I quote the Plus Elite and I quote the Premier Elite. The reason the Premier Elite is basically the same plan design, except you see higher deductible choices, right? $5,000 to $14,000, but you're going to have that same 100% coinsurance after the deductible. Difference here is when the person picks the deductible, they're picking it for the entire family. It is a pooled deductible. So you have 2, 3, 4 people all pooling towards one common deductible, as opposed to the Plus Elite plan, where you had 2 people in the family having to meet it in full before the rest of the family went to 100% coinsurance. So more than one person on the plan, I would quote the Premier Elite. One person on the plan, I would quote the Plus Elite. And actually for families, I quote the Plus Elite and the Premier Elite, and then let them choose, you know, what might be the better option from them from a cost perspective. Premier Elite works the same way as the Plus Elite. No deductible, no office visit coverage, but you do get deductible coinsurance, $50 unlimited urgent care copay, and outpatient prescription drugs are the same 4-tier schedule. Copay plan. A lot of people look at this plan thinking this would be our bestseller. They like to quote this plan. I don't quote this plan. Very, 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 very rarely. It's less than 2% of our sales. It's incredibly expensive compared to the other plans just to have a $50 copay for your office visits. And you do get a $50 copay per visit to your doctor or specialist. It is deemed how many visits you get according to how long the plan is. 1 to 3 months, you get 1 visit. 4 to 6 months, you get 2 visits. 7 to 9, 3 visits. 10 months or more, you get 4 visits. After that, it would be deductible coinsurance. $50 limited urgent care copay there, and the same 4-tier drug card. So now we're just going to take a closer look at some of the plan specifics, some of the network capabilities, and then explain, you know, where the product brochure is and to pay attention to the state variations. Next series of slides is really just illustrating to you that this is a major medical plan. It's not a fixed indemnity product. It's not, you know, an accident or just a limited benefit plan. It's going to do what a major medical plan does, with some exceptions. Preventive care benefits, mammograms, pap smears, and PSA screenings are a covered expense subject to deductible coinsurance, but you will get the negotiated rate. The adult office visit itself is not a covered expense. So the preventive exam itself to go see the doctor is not a covered expense. And it's not included in the hospital and surgical plan. X-rays and labs, deductible coinsurance. Outpatient surgery, same thing. Surgeon, assistant surgeon, facility fees, all covered deductible coinsurance. Outpatient expenses like hemodialysis, radiation, organ transplant, drugs, CAT scans, MRIs, again, deductible coinsurance. Emergency room fees, deductible coinsurance, you will be subject to an additional $500 deductible if you're not admitted to the hospital. I don't call that a deductible, I actually call it a penalty, because if you visit the ER, say you're on that Plus Elite plan and you've reached your deductible for the year and you're at 100% coinsurance, right? You shouldn't have any medical bill responsibility. And you go to the ER and you're not admitted, doesn't matter that you were 100% on the coinsurance, you will still have that $500 deductible if you're not admitted to the hospital. And the reason we use this is because we don't want people using the emergency room for a sinus infection. Now, the question always comes up, you know, what if I break a bone? I'm going to have to go to the emergency room and I probably won't get admitted. You're right. You probably will have to go to the emergency room. You probably will not get admitted. Unfortunately, you would be subject to that $500 deductible. Hopefully, that is a rare occasion for clients and that doesn't happen multiple times on the policy. Spine and back disorders, deductible coinsurance, $2,500 maximum covered expenses per person per term for outpatient office charges. I have done this webinar over and over, and then the question I always get is, and I still get it to this day, is $2,500 is not a lot of coverage if somebody breaks their back. You're right, it absolutely is not. But the key word here is, this only applies to outpatient office charges. It does not apply to inpatient expenses or outpatient surgery. So if you break your back, you are likely going into the hospital for a while. So this dollar limit would not apply. This typically comes into play for chiropractic. I see the maximum applied typically when it comes to chiropractic.
Okay, can I jump in just a second? I don't know that the unmute feature is working all that great, but by all means, put your questions in the question box. We're getting a few, so keep at it and good, healthy exchange. Thanks.
Ground ambulance is going to be paid deductible coinsurance, and then air ambulance is also now a covered expense at $5,000 per person per term. Other outpatient expenses, deductible coinsurance. Pre-existing conditions will not be covered on these plans. And how do we define a pre-existing condition? There's an awful lot on this screen. This is all the legal definition of it. The way I tell a broker to explain it so that you avoid a lot of the what about this, what about that questions is anything they were cared, treated, or took medication for in the 2 years preceding the effective date of the policy will not be a covered expense. It's not minimum essential coverage. Legal makes us say that, so it's not Affordable Care Act compliant, which makes it also sellable year round. AMWEL is going to be an optional benefit that's available to you. You can rider it onto the policy. It's basically Teladoc, gives you 24/7 access to virtual visits with doctors. Those doctors can prescribe medication. They will be located in your home state when you call, and it costs you $0 to video conference with them. $650 per policy per month, not per person, but per policy. Supplemental accident benefit is available as well as a rider on all of the plans. It allows you to push the deductible higher, which is going to cause a lower premium for the client, because what this does is it's going to eat up your out-of-pocket expenses in the event of an accident. Benefit levels are $2,500 to $15,000, so you should always match your benefit level for the supplemental accident benefit to your deductible. And that in turn is going to reduce your client's out-of-pocket exposure. So what happens with that supplemental accident benefit is it gets attached as a rider. If we get an accident claim, comes in, we see that you have an accident benefit attached to the policy. We're going to take and use those dollars to pay the claim, and then we're going to offset your deductible by that amount as well. Network, UnitedHealthcare is going to use a Choice or Choice Plus network. In the state of Ohio, it's going to be the Choice Plus network. It is the largest network of any insurance company in the country today, including any ACA writer. So when you put somebody with one of our short-term plans, you are putting them with the largest network of providers of any insurance company in the country, including anything they could get on an ACA plan. If you do have a state business, this would be pertinent to you. You do need to check the product grid to see if we use the Choice or Choice Plus network in the state. Like I said, in Ohio, we use the Choice Plus. The number of providers in this network is exactly the same. So Choice and Choice Plus are not two different networks. They are two different networks, but the number of docs and providers in those networks are identical. The only difference is going to be in how we adjudicate claims at the back end. So if you're working in a non-resident state that offers the Choice network, Again, big nationwide network, exact same docs and providers, except you cannot go out of network with the choice network. You have to stay nationally within our network, unless it's an emergency, which you could then go out of network. If you do go out of network electively, there would be no benefits paid. Choice Plus, which is what the state of Ohio has, again, same docs and providers, except you can go out of network, albeit with a penalty. There's going to be a reduction of benefits, which looks like a 25% penalty. So you will always owe 25% of that out of network bill. Your deductible will be 2 times the plan deductible, and there's no out-of-pocket maximum. So you go out of network, you're always going to pay 25% of that bill. You're going to meet 2 times the deductible, and even if after you've hit your deductible, there's no maximum to your coinsurance. So it doesn't really behoove you to go out of network if you don't have to. Network strength. Again, biggest network of any insurance company in the country today, 1.4 million docs providers, 6,500 hospitals nationwide. That gives us 85% of the hospitals in the country in our network. Payment on these plans can be lump sum via EFT or credit card, or monthly EFT or credit card. If you do pay lump sum, it is about an 18% savings to the consumer. And that's not available with consecutive term options. We do a 2x12 in some states. That is not an option that's available in Ohio.
This is a fantastic improvement. This was a big
Yeah.
ask on behalf of brokers, and they responded. They listened. This was huge, and we want to thank UH for making this adjustment.
Yeah, we had it. We got rid of it. We brought it back. And there's no application fee. There used to be an application fee on some of the older plans. There's no app fee on the new plans. Cancellations work a little bit differently. If you pay in lump sum and you want to cancel before your plan term is up, we will cancel you as of your next paid 2 month, basically, and then refund you for any unused months. On the monthly payment, we do not do cancellations mid-month and issue a refund anymore, so your cancellation would be as of your next paid to date on your monthly payment plan. And if you do cancel during the free look period, it would be a refund, 10-day free look. Issue ages on the plan, 19 to 64. We do not do child-only policies. Next day effective dates are available. There are, again, no waiting periods on any of the plans, and you can actually apply up to 60 days in advance of the effective date. That is going to be really, really quick. The new short-term product. Now, know if there are questions in the chat or if anybody has questions.
Yeah, those questions. Okay. So would UHC ever consider creating a guarantee issue short-term plan for members who can't pass underwriting? Other competitors have this.
Like a guarantee issue plan, we do have a guarantee issue hospital plan currently, but we do not have any plans of putting a guarantee issue short-term plan into effect. And the reason for that would be, and I'll just say it as bluntly as the underwriters would say it to us, is if you need a guarantee issue product because you have some health conditions, we would advise you to purchase an ACA plan. Because by the time we would design a plan that would accommodate health conditions on a guarantee issue chassis, it would start to cost as much as an ACA plan. So they just don't feel that it's a viable market for us. We would rather you just go to ACA at that point.
How can they access this hospital plan?
Hospital plan is in eStore in the broker portal. I don't believe it's available though in Ohio yet.
I see.
It's brand new. Yeah.
I gotcha. Okay. Next question. With exception of the guarantee issue plan, it's my understanding that these plans are fully underwritten, including the 12-month pre-X, the BMI, body mass index, etc. Is that correct?
Correct. They are medically underwritten. I can show you in the eStore. It's basically what we call field underwritten, which means if they answer yes to any of the questions on the application, they will not get a policy with us. If they answer no, that would be phase 1 of the application, meaning they answer yes to any question on the medical application. It's going to kick them out, stop you as a broker from writing that policy. They answer no to everything. They pass phase 1. The application gets submitted. Now, the second phase would be height and weight. Has to fill into our height weight chart. If when they enter their height and weight into the application and they're not within the height weight chart, it will kick them out, again, not eligible. And then the application gets submitted to us. The third phase of underwriting is we look back 5 years to see if they've ever been insured with a United company. If they've been insured with a United company in the past 5 years, we pull a claims loss report. If we get a claim that says they should have answered yes to one of the questions on the application, we will decline them. But we are not declining them because we underwrote that policy. We are declining them because they lied on the application. So, you know, one of the questions on the application is, are you a diabetic? They say no. It gets submitted to us. We find out they had a group policy with UHC in the past 5 years. We run the claims report and we find out they've been consistently filling prescriptions for metformin and insulin. They're diabetic. So we didn't underwrite them. We just caught them misrepresenting themselves on the application, at which time we would decline that person. So if you ever see a decline from us, you can call me and ask me, but 9 times out of 10, the only reason you're going to see a decline on the back end is because we have a claim that says they have X condition.
I see. Okay. And is there a different underwriting threshold based on the plan choice as you look at the different short-term plans, lean to rich? Is there a different underwriting threshold?
No.
Okay.
The underwriting threshold is the same. It's just an accept or decline mentality. So they just have to meet those 3 requirements: answer no to all the questions on the application, be in the correct height and weight, and then not have, I don't want to say, but not have lied to us about any claims they may have had in the past 5 years. That would cause a decline.
Okay. All right. Next question. Is there a way to quote in states where I'm licensed but not appointed?
There is a way to quote, but you don't want to submit the application. You can't submit the application that way. So I tell brokers, if you wanted to quote in a state that you're not licensed in and you're deciding whether or not licensing in that state is a reasonable expense for you to pay, being that you might not have a lot of clients, is what I tell people to do instead of logging into your broker portal, because you won't be able to quote there, just go to uh1.com and quote it as a consumer. Pretend you're a consumer, do the quote in another state. It'll quote any state that we're in, and then you would have a rate to present to that client. If the client likes the rate and wants to purchase from you, then you would want to go ahead and get non-resident licensed in that state with us, prepare the quote on your e-store, send it to them that way to apply. Okay, My UH1 just lets you kind of cheat the system by quoting in any state, even if you're not non-resident licensed with us there yet.
Okay, fantastic. Another question. Are these plans subject to ACA enrollment periods, SEPs, et cetera?
They're not. You can sell these plans all year long.
Okay. We are running out of time.
We are.
any last questions folks have? I'm sorry the mute button didn't work. We'll get that fixed. The unmute button, we'll get that fixed for next week. But I think we had a really good exchange today with the written questions. And Renae, did you have any final thoughts?
Do you want me to run through the dental vision, or do you want me to combine that with next week?
I think we combine that next week.
Okay.
Since we've sort of, hit our threshold here, we're up against 10 o'clock right now. And I promised everybody would be done by 10 o'clock. But I think that's it. No more questions. By all means, if you do have something extra, give me a shout, and we'll make sure everybody gets a copy of this presentation and just some resources and whatnot. We really appreciate you joining us today, and we look forward to you coming on next week, Wednesday, 9:30. We'll do part 2.
Awesome.
And with that, I'll conclude the presentation. Thank you, everybody.
Thank you.